Welcome to today's webinar hosted by Trans Advocacy Network. My name is Anand Kalra. You may have heard me on these webinars before as the Trans Advocacy Network Coordinator, which is still my position, and I'm also wearing another hat today, which is as Health Programs Administrator for Transgender Law Center. I'm so glad that so many of you were able to attend today. This is our 7th in our monthly series, and without further grandstanding from me, let's get going. For those of you who are new to the webinars that we've been doing or new to this software, here's a little bit of a primer on what you can do with the control panel. There is a red arrow that you will see that will allow you to expand or collapse the webinar control panel. If you don't see what's on the screen right now in terms of that control panel there, it's probably because it's minimized up towards the, sorry, it would help if I showed you what I was talking about. It's important for me to share my screen. Okay, so folks should now be able to see what I am showing you, which is that this is the control panel that I'm talking about. So there's a red arrow that allows you to expand or collapse the control panel. If you don't see it right now, you just need to find your red arrow and click on it up in the upper right-hand side of your screen. If you are listening in using your computer's microphone and speakers, that's just fine. If you find that you're not getting good sound quality for any reason, you can also use your telephone. If you just click that radio button for telephone, it'll give you the number to call in. If you have a question during the webinar, you can go ahead and type it in using this box right here. And if you'd like to ask a question out loud, you can click this button here to raise your hand. So let's just practice, make sure everybody knows what I'm talking about there. If everybody could go ahead and raise your hands right now, and then I will put them down for you. Okay, I see one person's got it. A couple people have got it. All right, looks like folks are seeing what to do there. Excellent. And I put your hands down now. Okay, so that is the quick and dirty on how to use the webinar software. Today we are talking about healthcare activism and particularly how local changes can make a difference at the national level, which is an exciting topic for me. I spent a lot of time thinking about this and how all these pieces can connect to each other. So you see in front of you that the purpose today is to empower local activists with the knowledge and resources helpful in healthcare advocacy across a variety of settings. And the way we're going to do that, we'll do a little bit of introductions. I'll tell you a little bit about me, ask a little bit about you, and we'll go through some general strategies that are helpful for organizing and healthcare organizing in particular. And then I'll go through some resources that are available to deal with specific cases, whether you're working with your primary care, kind of general practice clinicians, whether you were trying to work with a hospital setting, whether you're negotiating an insurance policy at your employer, or say for a city employee benefits kind of situation. And then finally we'll go through ways to test and enforce existing policies that are at the federal and state levels. And we'll have plenty of time for questions at the end. I see that one person has their hand up right now. I'm going to go ahead and go a little bit further before we do questions. If you do have a question that you need to answer urgently, please type it in the chat box, and then we'll do audio questions a little bit later. Okay, so a little bit about me. Like I said, my name is Anand Kalra, and I'm a Health Programs Administrator for Transgender Law Center. Though I work at the Transgender Law Center and I work on healthcare, I'm neither a lawyer nor a doctor. I'm actually a librarian by training, so the part of things that get me very excited are about looking at different pieces of information. There's many types of information, many individual pieces of information involved in healthcare and healthcare systems, and figuring out how do we organize that and how do we make them understandable for a lot of people. That's how my skills kind of come in here. If you have questions after the webinar, you're welcome to email me. My email address is right there on the screen. A little bit about you, and so we're going to do this using the raise hands function again. If you could raise your hand if you are new to trans organizing, trans communities at all. I'm imagining we don't have a lot in this group that's in that category. Okay, and if you're new to healthcare or healthcare advocacy, could you raise your hand? Okay, seeing a couple of people there, a few people. Okay, and if you're new to trans health advocacy, kind of putting those two things together, Okay, a few people there. And if you are an expert and you could be leading this webinar, okay, one person there, okay. And if you are already working on a trans health issue in your community or in your state, okay, a few folks in that category. Lots of overlap there with the folks who are new to this stuff, so I'm glad we're getting you where you are. And then folks who are feeling confident already in navigating the healthcare system. Just one person. Okay, so that's fairly typical when I do these kind of trainings and webinars. The healthcare system that we have in the U.S. is particularly complicated, and in my opinion, unnecessarily complicated. It's designed to benefit larger companies, and it's designed to put individuals at a disadvantage because there's so much specialized information that you need to know in order to get your care covered and in order to feel like you know what's even going on. So let's dig in. These next 5 strategies are things that are effective. Whatever kind of organizing you're doing, whatever kind of activism you're trying to target in whatever geographic area you're in. So these are exciting to me because they work at the meta level. After this, we're going to get into some of the details about healthcare in particular. So first thing you need to do is build a team. There are a lot of folks, I think especially in trans communities, because so many of us have grown up in isolation or are used to working in isolation. So there's a lot of us who feel like, you know what, I'm pretty skilled on these issues. I know how to talk about these things. I'm just going to go for it. There's nobody really around who can help me right now. That is a big red flag. It will get you into trouble, and it'll be really lonely. So reasons to build a team here are, 1, for the emotional support. You can share the joy of success, share the pain of challenges, and think through problems together. You combine your skill sets. You know, not everybody can do everything. In fact, nobody can do everything. So some folks are going to be better about planning. Some folks are going to be better about focusing on relationships. Some folks are really detail-oriented. And some folks have a better idea of kind of the broad view, the bird's eye view kind of thing. And you need all of those skills together in order to really be able to move an issue, especially when there's a lot of education that needs to be done with an issue like trans health, where the vast majority of people know little to nothing about it at all. It also takes multiple people because you're going to need to use strategies in your activism that require more than one person. For example, if you need to kind of focus in on a particular decision maker, and one person is going to be kind of good cop and be like, well, I know you're working really hard, but and kind of being the softie. And then the other person could come from the different angle and say, we really need this by this date, and we're really disappointed in your response so far, things like that. You just need more than one person. If one person is doing both of those things, it's confusing and scary to the decision maker. If you're holding a rally, or if you're holding any kind of a community vigil or an event like that, it's really important that you have people to show up there. So you can't do that by being kind of a lone wolf and then just expecting people to show up. Right? That doesn't work. I think most of the folks on this call know this already. I just go through it for the sake of just laying that foundation. And of course, there's more power when there are more people. There's strength in numbers, and there's strength in having a diverse group of people so that you can vary who your spokespeople are. If it's the same person out there in public every time, folks on the outside might say, well, this looks like it's really just a one-person deal. I don't know if this is something that I should put my time into. If people in the community are seeing lots of different or several different people on the same message, that makes it much stronger. When you're building your team, you want to recruit people for 2 things. One is expertise. Have they worked on these kind of issues before? And the other is energy. If they don't know anything about these issues, but they're willing to commit their time and their energy, that is a highly, highly valuable thing. If you have people who have expertise and energy, that is all the better. I think it's also tempting when we're building a team of folks to try and make promises. We're gonna get this goal accomplished in 6 months, and you're gonna be put in charge of the new commission that's gonna be in charge of everything. That's so dangerous, and just it's a recipe for disaster. If you set up these really high expectations for folks that you won't be able to come through on, because there's just larger things at play. You don't have control of all the factors. Though, make space for everyone's voice to be heard. especially if you're the person who's the leader of the group, it's that much more important to hear from the folks who are a little bit quieter, a little bit newer. One, so that you know everybody's on the same page, and two, because even if you're the expert on the issue, you don't know everything. Other people come with valuable skills, valuable relationships, and it's so important for everybody to be able to contribute. That is the first thing. Second thing you need to do is do your homework. This, I think, I would repeat this slide over and over again after every step because, you know, just to emphasize that there are things that we learn in every stage of every process, whether it's an activism process, whether, you know, you're just doing your daily job kind of thing. You need to stop and reflect and kind of summarize, wait, what just happened? How did we get here? Where are we going from here? So in this particular phase, once you've got people together, you know, assumedly you've already talked to folks a little bit about the particular thing you're trying to do or trying to get folks together to identify as a community what is the need. You want to have a really intentional conversation where you find out what is it that our community needs and how do we know that? Is it just based on a couple of people's experiences or, excuse me, maybe did the local Department of Public Health do a survey last year and maybe one person in the group knows about it. So you really need to flesh out what do we already know about our problem, what's most needed, what's achievable, and really important that I think some folks tend to skip over is what resources already exist and who is already working in this area. Again, because so many of us as trans people are used to being very isolated, it's very easy to assume that nobody else is working on an issue or nobody else has tried in the past. And very often that's not the case. So to save yourself time and frustration, it's very valuable to kind of ask around and say, is anybody else working on this? Or did anybody try and work on this and it didn't work out so well? Because you can add that much more knowledge to your campaign, and you can add that much more strength to your team. Next thing to do is to, once you've kind of gathered information about what's happening in the community, what are the needs, there are undoubtedly going to be a lot of issues that pop up. There's a list here on this slide that are just some examples of things people might want to focus on, whether it's homeless shelters, finding primary care providers who prescribe hormones, getting adequate mental health services, having better policies in hospitals, having insurance policies. You know, there's so many things that we could focus on, and it's so tempting to want to say we're going to do a comprehensive overhaul of the entire health system in the city or the county or the state. And if you try and do all of it, it will just be not functional. I wish that it were the case that one of these, that, you know, working on one issue would lead naturally to the next one, would lead naturally to the next one, and it would all build on each other, but it's just not the case. So as hard as it can be to prioritize and to choose not to do certain things, you just have to. And again, this is where it's helpful to be working with a group of people so that you don't feel that pressure all on your own. Well, we decided not to work on homeless shelters because mental health services were a higher critical need in our particular area. That stress of making that decision doesn't have to be on one person. So how do you choose which issues to focus on? You want to choose issues that are meaningful, movable, and manageable. And it's not just buzzwords that have alliteration, but these are really important concepts to focus on. If you end up being able to choose something that meets all three of these, that is meaningful, that is movable, and is manageable, you're going to have an easier time going through the particular change you're trying to make. It won't make it easy by any means. There will still be many challenges and many hurdles to get over, but it will be doable. Versus if you choose something that is, say, very flashy or has a big symbolic component, but doesn't have kind of meat behind it or teeth behind it, whichever metaphor you want to go for, it won't work out so well. You'll get 2, 3, 5 years into a project like this, and you'll realize, wait a minute, this isn't going to make the change that we thought we needed. If you're working on something that there is just really no political room to maneuver, that will also be very frustrating. And if it's something that is not within the scope of what a group of folks on the ground, most of whom are volunteers, if not everyone is volunteer, that's another big thing that's very stressful. And, we all know that trans health is, a low, if not the lowest priority for so many communities in terms of, outside of the trans community, that there is so much work that could be done, and there is so much work that we could do if we had 20 full-time staff and millions of dollars in funding. We could really change things faster, certainly, but that, without having those resources, it will just be that much more painful to choose a more ambitious project. Now, that doesn't mean you choose the lowest possible, the smallest possible thing you could do, because you still want to aim higher than what you think you can get, but not so much that it's kind of pie in the sky kind of situation. Moving on from here. Okay, so now, with summing up so far, you've got your core team built together. You've figured out what are the issues in the community. You've prioritized one issue, and you've chosen one issue to focus on. Then you need to pick a strategy. Are you going for a long-term kind of strategy, which would make community organizing a really solid approach, meaning that you would be building from the bottom up? You're focusing on relationships among the community and with maybe healthcare providers and maybe people who are working at the local offices of particular insurance companies. Maybe you're building relationships with elected officials or nonprofit organizations or state agencies, and doing the kind of really intentional, deep work, building relationships, building knowledge, doing constant leadership development, and keeping on showing up through every particular, if it's a city hearing and then there's 3 draft readings of it, and getting people to show up every time. Community organizing, that is the strategy that would work in those kind of situations. On the other hand, if what you are looking at is something that's more of a short-term kind of a goal, where what you need to do is influence a particular number of policymakers and get through to them with particular messages and kind of navigate bureaucracy, you may not need as in-depth and as comprehensive of a strategy as a really full kind of grassroots organizing strategy. And you'll see here that I have a little Venn diagram here showing that these are not mutually exclusive strategies, and absolutely there could be policy advocacy that's done as part of a community organizing strategy. But it's just a matter of focusing on what is the issue that we're working on and what do we really need. I think every community would benefit from having full-time community organizers checking in on folks, maintaining relationships. Everybody would benefit if that were the case. But if it's not completely critical to accomplishing the particular goal you're seeking, it may not be resource effective to have that kind of a comprehensive strategy. If you can do both and, all the better. So now you've picked your strategy, your issue, the research that's informing these things, and you've got your team together. Now you need to make your actual plan, and then of course after the plan, executing it. These are tips that basically common sense tips that there's nothing magical here, but I just wanted to summarize things in this section for what makes a good plan and what makes a plan that you can actually execute. One is just writing out all the steps you would need to do in order to accomplish your main goal. It's really common sense, but so often I see folks who are so excited and passionate about the issue that they're working on that they rush into something, and then you get kind of far in and you realize, wait a minute, we don't have a strategy here. So it's very important, if you can, before you get started ideally, or in the formative stages, sometimes things come up outside of our control. Write out all of those steps that you think you would need to do, and then break them into tiny, tiny, tiny pieces, like pieces tinier than you think actually would be sensible to do. Because when you're trying to work on a really complex issue, and especially when you're working in anything that's involving multiple systems, like you're working with doctors over here, and you're working with the receptionists over here, and you're working with the insurers over here, the more you can be specific and the more bite-sized the pieces that you've identified the steps are, the easier it's going to be to feel like you've done something meaningful, like you've had success at each step of the way, and the less frustrating it's going to be. If you get halfway through a large project and you've just identified one large goal, it's hard to feel like you've done things. But if, on the other hand, you've identified, there's 36 steps in this project and you're halfway through, I've done 18 things already. This feels good. It's good for morale, and it's good for if you're seeking funding or if you're seeking input from other folks along the way. It's good to be able to show, here are the particular things that we've done already. It also gives you an opportunity to check for interdependencies between the different tasks that you might need to do. For example, if you really need Congressman Smith's endorsement on a particular bill, you need to first build a relationship with Congressman Smith. So, it just helps you chart out what's the sequence of things or what's the sequence that we need to do things in. Second key thing to do when you're making your plan is establishing clear expectations among your team. For some folks, this might seem kind of corporate or kind of too, fuddy-duddy, but I find it's just a really good thing to do to, again, set that foundation so that there's things you can modify from if you need to, and things that everybody knows are the expectations. So how do you do that? One is in your plan, write up what is your communication plan. Are you going to meet once a week in person? Are you going to meet over the phone once a month? Are you expecting each other to be responding at all hours, or are you expecting each other, after 10 o'clock or after 8 o'clock or any particular time that you agree on? We're going to let it rest for the night. Is texting okay? All of these little details can really make a difference when you're on time pressure or when it's just a stressful situation. And, one person may be like, this person hasn't responded to me. It's been already 6 minutes, and the other person is expecting something more like a 2 or 3 day timeline would be all right. Just having that ahead of time really can reduce and prevent a lot of conflict in a group situation. In addition to building your team communication plan, you want to set up some clear roles for people. This doesn't mean that someone has to only do the thing that's assigned to a role, but it does help with a clear division of labor, so you don't have to worry about two people going for the ball or nobody catching the ball. Examples of that might be, if you're working with a clinic, have one person be the contact person for the clinic that you're working with, so that the staff at the clinic aren't confused by, oh, yesterday I was talking to Sally, and today I'm talking to Jim, and tomorrow I'm talking to Ariana. It helps with that consistency if you have one person be the contact for a clinic or for a congressman's office or something like that. When you have meetings, always take notes, and then you don't have to worry about what did we talk about last time. I know this is really common sense. It's really kind of unnecessarily explicit, perhaps, might be boring, but I really do find that it's so often these basic things we forget about because we get so excited about the particular issue that we're working on. The next role that I suggested, I called it deadline harasser. You might call it like coordinator or timeline person or something like that. Someone who's going to really go around to folks and say, hey, we agreed that you would have this document to the group or to the clinic by next Tuesday. Just want to check in with you, make sure that's on track. I know everybody is a busy person, and especially if you're working a full-time job or juggling multiple part-time jobs and at the same time trying to work on any kind of community issue, it's hard to prioritize that, and it's hard to just remember the details of the things that you said you were going to do. So if you have someone who's assigned to keeping track of those deadlines, that is a helpful way to make sure that things get done in the time that you need them to get done in. Team roles also help distribute the work among team members so that one person isn't doing too much of the work, or the converse of that, one person isn't getting away with not doing any work. So if you distribute things among team members, everybody's happier. And at the bottom, I think I've already mentioned this, but very, very important to set time limits and deadlines. Even if you end up not meeting the deadlines, and even if you end up needing more time than you initially thought you would, it's really helpful to have a shared understanding of how much time do we believe at the beginning it's going to take to do X, Y, or Z. A couple more notes on how to make a plan. I myself, as you can tell, am a planner, so I have a lot of thoughts about this. One thing is to include research as part of your plan. Because research is kind of something we're used to doing on Google these days, we expect it's going to be fast, we expect it's going to be easy. We kind of take for granted that we would need to do it. But it does end up taking time, and especially if you know that you're working in an environment that you're not familiar with, you're going to need time to familiarize yourself with just basic terms and definitions. And if you're working with, say, your division of insurance in your state, you need to know how is it structured and what are the different forms that we might need, or what are the forms that we're trying to fix. You just need that kind of research, as well as getting a sense of the background. in terms of, kind of at the big picture, what is the state of trans health? What is the research saying? The academic research or the public health research. What is that stuff saying? Easy to skip over, easy to forget about, but if you plan it, if you build it into your plan, it'll be less frustrating later on when you realize, it's the night before we have this big meeting with the decision maker and we need to give them all these statistics and give them all these stories. If you've done that ahead of time, it won't be stressful. Very important to include in your plan is recruiting an ally in the institution you're working on. So if you are working on a community clinic, or if you're working on an insurance company, if you're working on a hospital, if you are familiar with and you have relationships with people who work internally in that organization, it's so much easier to get the change that you are that you're seeking. Because one thing is it changes it from an us versus them kind of dynamic. So you're meeting with management and they're upset and you're upset, or even if it's positive, it's still there's this boundary there. But if you have someone from the inside who's working with you, suddenly there's this shared we, and there is a greater capacity for making changes, particularly because someone who's working internally at one of these organizations or these kind of big bureaucratic systems or small bureaucratic systems, they're going to know what the landscape is internally in terms of the internal politics. Usually, here's an example, usually with a form from HR, you would need to go to Shirley, but Shirley's out on vacation or she's out on maternity leave, or she just doesn't like this issue, so you actually need to go to Jeff. Whatever those kind of particularities are, having someone on the inside can help you with that. And even if they don't know up front, they're going to have an easier time figuring out who to ask internally versus coming from an outside perspective. And then finally, as much as we can plan, you always need to be prepared to adapt to unforeseen barriers. There's just always going to be things that come up that you didn't anticipate, and it's nobody's fault, but they just happen. So I guess what I would say is to try and be as patient with yourselves and with each other as you can, because there's just going to be things that make life harder. So when you are working with any kind of decision maker or just an ally who's new to the issue but has energy and wants to help, it's critical that you always do a Trans 101. There's so much more coverage in the media and on TV. In the news media and on TV and on internet articles and blogs and everywhere about trans issues generally, and even trans health in particular, that a lot of people believe that they are kind of already experts because they read something one time or they have a friend who's trans. But that is not true, as I think most people participating in this webinar already know. And it can be sometimes a little bit uncomfortable if you're feeling, if you feel like you don't want to offend someone by going through the basics with them, but it always is going to save you trouble later down the line, because those folks may only have a vague sense of things and how they work, and they themselves may be self-conscious or nervous about saying the wrong thing, and so they may not participate as much, or maybe they aren't worried about saying the wrong thing, and then they do say the wrong thing, and then people get ruffled. So it's best to do this early. Flush out those misconceptions. Just go through basic terms and definitions. Give people some context about what employment discrimination looks like, what homelessness looks like, what health disparities look like for trans people. All those kind of basic categories that a lot of us who've been working on trans stuff for a long time kind of take for granted in the back of our minds that this is just the way things are. For folks who are new, whether they're trying to work with us or whether we're trying to work on them to make a change that we want, they just need that basic level. If you can combine stories, personal stories, with statistics, that is what tends to make magic for people. Some people respond better to one or the other, and you may not need both, but for to be safe and to be most effective, if you can share a key personal story of someone in your community or a close friend or family member of someone in your community and how the particular issue you're working on has affected their life, and frame that, give them context with that, to highlight this is not one isolated incident, and really put it in perspective for folks, that can be very helpful in convincing people who at first might seem indifferent or even hostile to the issue. Now, if you're worried about not having statistics about your local area, that's okay, because there is a fantastic report that was published in 2011 by the National, now they're the National LGBTQ Task Force and the National Center for Transgender Equality. They did a survey that I think probably some folks on the call participated in, and maybe some folks already are familiar with this. But they surveyed over 6,000, almost 6,500 transgender people in the U.S., which is just the largest sample that I've ever heard of for anything that's focusing on trans people in particular. The reason that it's great to have a large size, a large sample size, is that means that any of the statistics that they're referencing are going to be more likely to have actual statistical significance. When we're working with a population that's as small as the trans community, it can be frustrating because we're looking at studies that are saying good things, but maybe they only have a sample size of 20 people or 50 people. And when you show that to somebody who's a decision maker, they're going to say, these are tiny numbers. These can't possibly make a difference. So this is a really good tool to have in your arsenal. There is lots of context. There are lots of statistics. There's graphs you can cut and paste and include. And there's breakout sections on health, on HIV, on homelessness, on employment discrimination, on housing discrimination, a lot of different things. And each one of those is broken down by race, and most of them are also broken down by gender identity, within the trans umbrella. So very, very valuable research in there. There's also an executive summary. If you don't want to pour through the whole thing, you can look at the executive summary, get the general gist of things, and then later go in and dig in and figure out what is it that you need from there. So highly recommend using this resource. Your second best friend, if I can say so myself, is a publication that Transgender Law Center put out before I started working here. So I'm not claiming that this is my thing that I made and you should all use it. I was very happy when I got here and found that we had this resource already. Some of the things that I'm saying on this webinar are included in it, and there's a lot more detail, including particular strategy tips for working on particular types of health issues. And there's case studies that cover both rural situations and urban situations. So you get a sense that not only can you do things in a rural area, but also you get kind of a sense of how much you can do and what has worked already before. So you don't have to reinvent the wheel. You don't have to start from scratch. Oh, I should say anything that's underlined here, these are all linked in the PowerPoint, and I'll post these on the Trans Advocacy Network website after the webinar. You can access them through the link that you'll get in the follow-up email that should go out at midnight tonight. So you can click on all these links. They're all live links. They'll take you directly to the resources. Okay, so before we jump into specific things for specific health cases, I want to do a little pause and see if anybody had questions at this point. Okay, looks like nobody has questions. So let's just make sure that everybody can still hear me and that everybody is still awake. I know this stuff can be kind of dreary. So go ahead and raise your hand if you had lunch today. Oh, good. I'm glad that we have. Okay, and raise your hand if you can hear me, but you didn't eat lunch. Okay, good. Excellent. Glad that you all are still with us. And anybody have a question now? Okay, we will plug right ahead then. So, oh, sorry, let me go back and just cover what it is that we're going to look at. So there are many more contexts than this that you might be working in, and happy to take specific questions on this at the end. But the ones that I'm going to go through are particular things that I have found useful working with primary care situations, working with hospitals, working with employer insurance policies, working on HIV prevention and care retention, and then testing and enforcing existing protections. And I'm not going to give so much of like kind of tips and tricks as much as just here are the resources that can inform you and can be very, very helpful. So first, for primary care, these are situations where you might be in your local community and just trying to find out, is there anybody that one of the most common questions that I get from people is, who is the doctor in my area in Dubuque, Iowa that I can go to who, is educated about trans issues, knows about trans medicine, is going to treat me like a human being, and I won't have to be teaching them the medicine. And so a lot of folks in areas are working on trying to have specific directories of providers, or once they've, or they're working with providers who are interested, who are willing to learn about trans stuff, but they're not educated at that point. So these are resources you can use. I highly recommend sending folks to Transline because as much activism as we can do, a lot of times medical providers, they just want to hear it from another medical provider. They don't trust it if it's coming from a community member, a patient, even if you're giving them the exact same information. So Transline is an e-consultation service that is all online, and basically a medical provider just goes online, puts in their question, says, you know, I'm working with a trans patient for the first time, I don't know what to do, and an expert will get back to them within 2 days and provide them links, provide them resources. They can also ask specific questions about specific patients that they have. You know, they might say something like, I have a 55-year-old trans woman who's on this dose of spironolactone and on this dose of estradiol, and she's having deep vein thrombosis, and I want to know what I can do and what's the appropriate dosage. They can ask that level of specificity, and because the folks on the other end are medical professionals, and they can answer, they can handle that stuff, and they do an excellent job of it. Transline is a collaboration between a few of the different LGBT-focused clinics throughout the country. I think currently there are 4 organizations collaborating on that, which is Lion Martin Health Services here in San Francisco, Bay State Health out in Western Massachusetts, the Mazzoni Center in Philadelphia, and, oh gosh, I'm embarrassed, I'm forgetting who the 4th one is right now. So if you are on the call and you are from one of those organizations, oh, Fenway in Boston. It's the Fenway Health Clinic out in Boston. So Transline, excellent resource. It's also the kind of thing where if you, you know, go to your doctor or your nurse practitioner and you tell them, I'm interested in transitioning, or I've been transitioning and I need help maintaining my hormones, and you can just give them a little printout or email them if you have capability to email them with the link to Transline and say, don't take it from me. Here, you know, talk to the experts. Other things, if you are kind of in more of a situation where you are doing a training with a clinic, you can give the docs, give the nurse practitioners and the nurses access to the protocols that already exist. I think a lot of times from the medical professional perspective, they're kind of overwhelmed because they've never done trans work before, and so they have this feeling of, oh my gosh, well, I have to invent the wheel here because I don't know anything about it, so that means nobody knows anything about it, which, of course, is not true. So there are established protocols for every aspect of trans care that exist already. The UCSF Center of Excellence for Transgender Health has very detailed, very explicit, excellent guidelines that are linked there. The Tom Waddell Clinic, which is a clinic in the public health system here in San Francisco, also has great care guidelines. The Vancouver Coastal Health Clinic has, again, wonderful, detailed guidelines. And all of those you can send them links to. You can print them out and hand them to them. Any of those things, you know, just to get the information in the hands of the people who need them. Of course, there's WPATH for those not familiar. That's the World Professional Association for Transgender Health. They issue these standards of care every couple of years. They revise them, and the most current is the Standards of Care 7. So that stands for World Professional Association for Transgender Health Standards of Care 7, which is why I use the acronyms for that. It's kind of a mouthful. And the standards of care are just basic guidelines that are not as much kind of this level of dosing in this kind of labs, not that level of granularity, but it gives the rationale for why transition-related care is medically necessary, and contextualizes it and gives an overview of what the different surgical interventions might be, what the different hormonal interventions might be, what kind of mental health care might be needed. All of that. It's pretty comprehensive. In addition to that, a number of different professional organizations have issued statements explicitly stating that transition-related care is necessary, that it's the appropriate clinical treatment to treat gender identity disorder, gender dysphoria, and so on. And that includes the American Medical Association, the Endocrine Society, I believe the American College of Obstetrics and Gynecology, ACOG, also has one, the American Psychological Association, the American Psychiatric Association. Those can be very helpful, especially if you're dealing with someone who's kind of skeptical. And they're like, well, I don't know, is this, this is kind of experimental stuff that they were doing back in the 70s. You can say, no, actually, current statements from leading organizations, not fringe groups, attest that this is medically necessary care. So the link there takes you to a Lambda Legal resource that lists most of those all in one document, so you don't have to hunt around for all of them. And then finally, there's a brochure that I like to use that Transgender Law Center developed, again, before I got here, that is it's just 10 tips for healthcare providers working with transgender patients. It's basic common sense stuff to get folks comfortable with the idea. It's good for an introduction, so if you're able to get an introductory meeting with, say, the medical director of the local clinic, and you want to leave them with something good to leave behind that's not going to overwhelm them too much, and so you try and schedule a next meeting, you can leave them with this pamphlet. You can print it out directly from the website, from the link right there, and leave that behind with them. So I know that I'm going through a lot of stuff right here, but again, the slides are going to be available online. You can download them. You can click on all the links, and at your own pace go through them. Okay, so besides primary care, you might be working with a hospital. You might be trying to get a hospital, if a lot of trans folks in your community go through the ER or need advanced care for HIV-related infections or things like that, it's really important that your hospital is able to treat folks respectfully. Lambda Legal has a best practices guide that is excellent. It's very kind of to the point and gives the context for various things like how to appropriately room trans patients, basically sex-segregated facilities for hospital rooms, for bathrooms, how to write a non-discrimination policy that's effective, and things like that. And I think they do a really excellent job of putting the onus on the hospital themselves. They are citing the relevant federal laws and non-discrimination laws that say that you can't discriminate against transgender people in a healthcare setting. And really, it's a good thing to give to hospitals because it's a little bit scary. It's giving them the impression, which is true, that if discrimination were to occur in their hospital, they could be accountable for that. So I think they do a great job of presenting the issues in a clear, easy to understand way without sacrificing the details. And they do a really nice job framing it. So it's something that you can use both as an advocate to understand the issues and also as a leave behind if you're working, say, with hospital administrators. There's also a new organization that started, I think, earlier this year or maybe last year called the Rainbow Healthcare Leaders Association. And this is a group of hospital executives who are LGBT or allies. I recently did a presentation for them and met some wonderful folks who are very excited and passionate about the issues. So if you're working with a hospital and you're kind of trying to get a sense of how do hospitals work in general, there's all these layers of bureaucracy, there's all this different kind of administration, there's utilization and management, there's this and that. You can contact the folks over there. Jerry Mackey is the incoming president, and feel free to tell him. I went to a presentation by Anand Kalra. He said you were a great resource. I'm sure he'd be happy to help you out with that kind of stuff. If you are going more on the insurance side of things, if you're at your company or you work for the city, you're a city employee or a county employee, and you're trying to get the employer benefits policy to have trans-inclusive coverage, there is a guide for you. This is one that I did contribute to here at Transgender Law Center, and of course we worked with our colleagues in other organizations as well. It gives you kind of all the information that you need to know to have to feel confident and feel educated having a conversation with an HR department and with the insurance company on the other side of the negotiating table. I think there's also, the first section is also excellent at framing trans health in general, kind of giving a nice package to who are trans people, why do we need health care, what kind of health care do we need, and give some good statistics and give some good updates on the law so that there's a kind of a comprehensive feel to it so that you can feel like you know what's going on, and when you're talking to someone you can articulate it in a helpful way. I think this one, that summary section, that first couple pages, first 3-4 pages of this document would be helpful regardless of what area you're working in, and then of course then the subsequent parts are particular to insurance. If you're trying to focus on HIV prevention and care retention, or you're working with the local county office of AIDS and you want them to do better outreach to the trans community, there are excellent resources. There are there's lots out there. I highlighted just a few of them. Again, the UCSF Center of Excellence for Transgender Health has wonderful documentation. They have some great fact sheets, and they have, they've implemented several different kinds of intervention models or intervention programs with different models, different approaches, and they post their models right up there so you can, you don't have to feel like you, again, need to invent the wheel or start from scratch. There are existing programs that you can base yours off of. Of course, every community is going to have different circumstances, different contexts to adapt to, but as a general starting place, the UCSF resources are wonderful. The CDC is also catching up. The CDC now has a fact sheet about transgender people and HIV. And if you're working with folks who are kind of new to trans communities or skeptical about it, it's so helpful to have a mainstream organization be producing this information. So that's also something you can hand to folks. These are good for conversation starters. Once you get deeper into the work, you would need a different, different levels of kind of documents. You would need kind of more research-heavy information, which is out there, but I'm guessing that most folks on the call are kind of starting out at intermediate or beginner intermediate level based on what we talked about earlier. I think one person on the call was an expert, but besides that, these are good starter documents for HIV. Do I have, oh yes, okay, so that is the particular health settings that you might be working in directly. And then there's the situation where there's existing policies, there's existing law and existing regulations that are making things a little bit easier for transgender people, and and they're written on paper, they're filed away in the code books in the state library. But how to make them real for real people is another issue altogether. So this is something. These next 3 slides cover things that folks can do pretty much anywhere where these laws apply, and you can have impact at a much higher level. So one thing that is really key that a lot of folks are talking about right now is the Affordable Care Act, which you may have heard called the Affordable Care Act. You may have heard it called Obamacare. That's what we're talking about here. It's a very complex law with a lot of different sections in it. There's the section that established these healthcare exchanges that we've heard a lot about, and then there's this little non-discrimination section tucked in there, section 1557. What it does is it prohibits discrimination at the level of benefits administration in any healthcare setting that receives funding from the Federal Department of Health and Human Services, which is pretty much every health program, because this would be anybody who accepts Medicare payments, for example, which is almost every clinic and every hospital in the country. It's there's arguments to be made that this applies to situations where it's an insurance company that's participating in the federal exchange and getting subsidies from the federal government. Any type of this kind of situation, this section of the law applies to. So if you experience discrimination, or if a friend or a family member or a coworker experiences discrimination in a healthcare setting, you have recourse, which is you can file a complaint with the Health and Human Services Office of Civil Rights. And again, that link is right there on the slide. When you download it from the website, it'll be a live link. And what that does is it officially registers that something bad has happened, right? And the Office of Civil Rights will investigate the claim, and they'll find out if there is something that they can directly do about it, whether that's issuing a penalty to the organization or the clinic or the company that you're involved with, or whether that's even they might, if it's a severe infraction, they might say, you know what, you're not going to receive federal funding until this is resolved. And that's a big scare for a company like that. It's so helpful to have this law on our side, because even though it is, it's not going to prevent discrimination from happening, it's an after-the-fact kind of a thing, it's still, again, coming from this large institution, a mainstream institution, a governmental institution that packs this punch with it. The more complaints that the Office of Civil Rights receives, the easier it is for our colleagues over at NCTE and other folks working in the DC world to make the case that our issues are real and that it's not just a fringe thing, and that it's not that situations of discrimination are not just incidental. And it also makes it easier for folks internal at HHS to make the claim, to make the same claim up the chain of command, and have have these things really have power behind them. There are currently not regulations that explicitly define how 1557 is supposed to be interpreted. So we're encouraging people to file these complaints. I'm not sure what the typical timeline is for responding to them. My guess is within 90 days, which, if you're in a situation where you've really just been hurt emotionally or physically in one of these environments, this is not the thing that's going to fix it right away. It's a longer-term thing, and it's a thing that works best in aggregate with a lot of different complaints. Another thing that existing policies that you can test and try and enforce through a complaint process is there are these 9 states that are listed here, plus the District of Columbia, that have insurance bulletins from their state division of insurance that basically says insurance companies cannot discriminate against transgender people in their insurance policies, meaning that they can't deny coverage for treatments that they cover for non-transgender people. So I know that's a mouthful. Let me explain what I mean. So, for example, if you have an insurance plan through your employer and you live in one of these states and you're seeking hormone replacement therapy, and the insurance company says, oh, we don't do this for transgender people, that constitutes discrimination, and you have recourse, and you can appeal that, and you can win. So, because, for example, most insurance plans will cover hormone replacement therapy for other reasons, for women who are menopause and need stabilization of their hormone levels, or for people who've had hysterectomies or oophorectomies and don't produce their own hormones internally, they're going to need exogenous hormones. So, if they're saying that they won't cover it just because they're trans, that constitutes discrimination. They're not allowed to do that. There is also, so basically the arguments that have been used to establish these insurance bulletins are ones around parity, meaning that if they pay for it for non-transgender people, they have to pay for it for transgender people, and around medical necessity, which establishes that transition-related care is not cosmetic, it's actually medically necessary, and they use the arguments that I mentioned before, like the statements from the professional organizations like the AMA and the APA and so on. I want to pause here because I realize that I skipped over something that's very important, which is that a lot of transgender people really don't like to be diagnosed for good reasons. We don't want to have this label attached to us that says we have a mental disorder or a psychological disorder, when really, it's just that our insides don't match our outsides. Our identities don't match our bodies, and that we may want to modify them, and that it can be very stigmatizing to some folks, especially who have been subjected already to cruelty in psychological care. It's very stigmatizing to have this extra thing attached to it. I understand that. I hear that from folks a lot. And unfortunately, with the health system that we have, there's no way to get treatment without the diagnosis. And that goes for any kind of a treatment. So if you were to go in with a broken leg, you would have a diagnosis of, there'd be a particular term for it, but, bone fracture and, related tissues that are disrupted and need particular treatments. Every single thing has a code. When you go in for your well visit, your routine checkup, there's actually a code that just says routine checkup. Because it's all done through these large complex systems, and now it's all on computer systems. So if the computer doesn't have a diagnosis code for something, it'll issue an automatic denial from the insurance company saying there was insufficient information to determine this claim or something like that. So as much as it can be painful for folks to have a diagnosis associated with their health record, it is the only way to get insurance to pay for it. So kind of did a little sidebar on that. So coming back to where I was, again, if you're in these 8 states plus D.C., and then Maryland has an asterisk on it because, so in the 8 states plus D.C., what happened is their state-level insurance regulators, the state agencies that are in charge of making sure that insurance companies are following the law, have issued bulletins or statements or guidance to all the private plans in the state, private plans meaning through employers or if you're buying on the individual market, that says that you cannot have line item exclusions that prohibit covering care for transition-related services, and here's what they look like, and basically just making that clear to the insurance companies that what they're doing is not lawful. This is great. Again, it's a thing on paper, and translating it into reality is a different situation because insurance companies are used to being able to say no to people. They're used to being able to have all the power that they want, to kind of just dismiss claims when it suits their interest to do so. So a lot of times kind of what we're seeing happening is that at the higher levels in the insurance companies, they'll say, yes, we're complying, but that information somehow doesn't seem to make it down to the customer service reps. So that when you have a question and you are calling the number that's on your insurance card, the person on the other end of the line says, oh, no, that's not covered. We don't know anything about that, which they may be telling the truth, or they may not be. We don't know. But either way, what the law says applies, whether or not the person on the other end of the phone at the insurance company knows it. So typically what we're seeing happen is, you'll go to your doctor and they'll put in your prescription for hormones, or they'll give you a referral to a surgeon, and the insurance company comes back and says, oh, no, we don't cover this. What you do in that situation is you work with your provider, and they will file an appeal to the denial of the claim, and they'll cite the relevant law and bulletin for your state, and they'll make the case that this is medically necessary care for you, or if this is your family member or your friend. And then they'll file that appeal. The insurance company will have a certain amount of time to respond. Usually it's 30 to 90 days. And almost all the time, once you appeal it, then they say, oh, yeah, oh, that thing, yes, oh, that thing, yes, we know what you're talking about now, and then they'll pay for it. So it's tough to attribute malice to what they're doing, but it does certainly seem to be a pattern. The other thing you can do, because your state Division of Insurance has issued this bulletin, is it gives you access to the appeals process with the state agency. IMR there stands for Independent Medical Review. That's the way that many states are choosing to go with it, where if you're experiencing a claim denial that you think is not supposed to be happening, you can appeal to the state Division of Insurance, and they will have their medical reviewers review your case and decide based on what your plan covers whether the denial is valid or not. I know that what I'm saying is very convoluted and very confusing, so if you have questions, if you need any information about how to get through an appeal process, Transgender Law Center can help with that. We are happy to help with that, and we are very interested in gathering stories of people that this is happening to, so that we can, again, turn right back around to the insurance agencies that we've just been working with and saying, and say to them, we're so grateful that you've issued these guidance to the insurance companies, and look, this is still happening. We need you to take another step. So having those stories is so helpful, and we are, again, happy to help you through those processes. The situation with Maryland is a little bit different. Their state division of insurance issued a bulletin that said that exclusions were lawful, but they had to be narrowly interpreted. So basically what we've been seeing in the past, before any of these things were on the books, was that if you were transgender and you came in with bronchitis, oftentimes the insurance company would say, oh, well, your immune system was weakened because you were on cross-gender hormones, and so this is related to your transition, and so we're not going to cover this, which is, of course, there's no medical basis for that, but they would say it anyway. And so what the Maryland bulletin does is it says you can't do that. Basically, if you're saying that you have an exclusion for transition-related care, it has to be specific to transition-related care. There's a little bit of wiggliness with the Maryland one. If you live in Maryland, feel free to follow up with me afterwards, and I can connect you to folks who are over there. Or if you're working with folks in Maryland already, all the better. Because it's a little bit wiggly language, and I don't think it's as bad as it looks, but it would be certainly much clearer if there was explicit language about the exclusions. I know that we are running low on time, and I've talked a great deal. I have one more slide, and then I'm happy to open it up for questions. So again, testing and enforcing policies. If you live in one of these states in D.C., your state's Medicaid program is not allowed to refuse coverage for transition-related care. So this is essential for so many trans communities, because so many of our community members are low income or have disabilities that make them eligible for the state Medicaid program. So if you or your family member or your friends or your community members have Medicaid and you live in one of these states or D.C., and they're getting denials for transition-related care, you also have recourse, just like with the private side on the slide that I was just on before. You can, again, partner up with your providers. They can file those appeals. They can help you jump through those hoops and figure out what documentation you need. And you can file complaints with the state agency that's overseeing your Medicaid program and saying, hey, this is not what's supposed to be happening. And again, with any of this stuff, if you're trying to figure out what documentation you have, what kind of insurance you have, what you need to do, when you need to do it, what needs to be included in the thing that you're sending to an insurance company or a Medicaid program, Transgender Law Center can help. That link right there takes you directly to our intake form for our legal helpline. Tell us what's going on, and we will get back to you, and we will help you in as much detail as we can. So that is what I have prepared here. I'm so happy to open it up for questions. I know that I have just talked a lot and talked about a lot of really kind of convoluted stuff. So I will pause and let folks raise their hands or type their questions into the chat box, and I will answer as many questions as I can. Okay, I see one hand up. Jean, I just unmuted you. Go ahead. Oh, actually, it looks like, Jean, on your dashboard, you may have hit the mute button.
Okay, can you hear me now?
Yes, go ahead.
Can you hear me now?
Mm-hmm.
All right, so my question is a little bit specific. You were talking about how Colorado had those protections as far as you could not be denied the health care if it's covered for non-trans related issues or non-trans people. And I have, well, my husband and me, we were stationed up here in Colorado. TRICARE West has the contract through United Healthcare, which is their branch is out of Georgia. So I'm not sure because they denied me for a name brand, but they approved a generic testosterone. They wouldn't let me do the gel. They just let me do the injectables.
Mm-hmm.
But they denied me, saying that they only give that to males over the age of 17. And so I'm 28, so I'm over the age, and I do identify as transgender male. But they did deny me on that cost, so I wasn't sure if I needed to consider Colorado law with that or Georgian law, or like what I needed to do with that. And a lot of people here don't seem to really be able to know.
Yeah, so that's a tough one. You said you have TRICARE, is that right?
Yeah, it's a TRICARE. It's a United Healthcare. United Healthcare, military, and veterans who do have the contract.
Mm-hmm. So TRICARE is its own thing. With the two types of things that I was highlighting, one was for insurance bulletins for the private insurers, and the other was for Medicaid programs. Unfortunately, TRICARE is not regulated by either of those. It's its own thing, and there are folks who are working with the military to kind of improve their systems, but unfortunately, these particular things wouldn't apply in that situation.
Oh, okay. Yeah, someone had told me before that I would have to consider the Colorado law, but I just wanted to get a verification on that because it sounded like it might have not been exactly the case. So.
Yeah, I think it would be a little bit outside the scope.
All right, thank you.
Mm-hmm. Okay, and let's see. There was a question that came in on the chat. Let me just see what it said. Oh, the person said, thank you very much. I appreciate the resources. Thank you to that person. Are there other folks who have questions? And I'll add on to Jean, with the situation with TRICARE, it's certainly worth investigating. You know, if they're subcontracting in a particular way and it's all housed within Colorado, it may be subject to Colorado law. I don't want to completely discourage you. But I would talk to the folks over at One Colorado. I don't know if you're familiar with that organization, but they are excellent. And they can suss out for you whether and which laws would apply to your situation. Okay, I see. Lori, go ahead. Lori, are you there? Oh, Lori says no mic. Okay. If you have a question, Lori, go ahead and type it in your chat box. Okay. So Lori's asking, does anyone have an approval from insurance and then after the fact have the claim denied? I have not heard of situations where that's happening on the same claim. What I have seen happening is that every time you renew your prescription for hormones, they deny you and you have to go through it all over again. I've seen that happening in certain cases. Once they've given it to you in writing that it's approved, it's approved. I know that with these situations, it's a very high stress for a lot of folks because you're trying to schedule surgery and you're trying to plan your whole life around what's going to happen in these, 2, 3, in the day that you have surgery, and then plan for aftercare, take time off of work, and all that kind of stuff. And then, there's follow-up. Lori says Blue Shield approved gender assignment surgery with particular surgeon in writing on June 9th and then denied the claim on September 20th. And I'm guessing, Lori, that was after the surgery was completed. If that's the situation and you're in one of these states, then what you can absolutely do is appeal that denial. If they, if the reason that they're giving is that they don't cover transition-related services, or the reason that they're giving is that this particular surgery is not covered, you absolutely can fight that. You typically have 6 months from the date of the denial or the date of service, it depends, to do that appeal. I would absolutely encourage you to file an appeal within the insurance company, and then also file a request for an independent medical review, an IMR, with the state regulatory agency. And if you want to follow up with me after the webinar is over, I'm happy to kind of check in with you about which regulator you have and what your options are for that. Thanks, Lori, for that question. I'm going to wrap it up now because I know it's late on the East Coast, and I'm so grateful for you all for participating in this webinar. The next webinar from Trans Advocacy Network will be in November. We're still nailing down the date. I believe it's going to be November 17th, but you will find out from our Facebook page. That is going to be on the topic of immigration, which is very exciting right now. There's lots of wonderful things happening from the advocacy side, and of course there's lots of stalemating and lots of scary things happening from the Department of Justice and ICE and Customs. So looking forward to sharing that information with you all next month. And next month things will be a little bit calmer because I won't be doing both the logistics and the presentation. So if you were a little concerned that I was talking too fast, don't worry about that for next month. So thank you again for participating. If you want to learn more about Trans Advocacy Network, or if you're part of a group and you want to join Trans Advocacy Network, take a look at our website or send me an email. Thank you so much and have a wonderful evening.